Okay, thank you, Timothy. I'm going to be talking about a project that we are implementing on addressing monitoring and evaluation gaps in integration of sexual reproductive health and HIV services. Now, just some background. This is the outline of my presentation. And from our previous presentations, even since the morning section, integration is documented as a successful strategy in resource-limited settings to increase access to services, especially for the poor, the marginalized, and the underserved. So Family Health Options Kenya, which is a member association of IPPF, pioneered the integration of HIV services into sexual and reproductive health in Kenya, and we worked very closely with the Ministry of Health. So some background on how we did that and how we had a successful integration. When we started integrating our services, along the way we realized that we cannot just integrate services and leave out the monitoring and evaluation bit, which sometimes some programs do not really address. So for us to ensure that we are integrating services and capturing good data on how actually we are integrating services and generating that evidence, we had to go through various processes to ensure that we get quality data and also ensure that our service providers are able to monitor and make decisions based on the services they are providing on the ground. So initially we had a manual system for capturing data, and we developed a number of integrated data capture tools. These were the daily activity registers, client cards. We developed integrated client cards, daily summary tools, and monthly summary tools. And we really involved our staff in developing these tools so that they own the process and also make use of the tools. Then along the way we realized that we were serving quite a number of clientele of different people who are users of our data. We needed to submit data to ministry and in terms of reports, our donors, and also for our own internal consumption. So we ensured that all our data collection tools put into consideration the needs of all our different service users. So we trained our service providers on M&E so that they understand the basics and also they understand the need for getting this data and collecting the data and use it for decision making. However, in the process, we realized that as we were tracking integration, our daily activity registers can show you that a client came and they accessed all these services. But then you can't tell which was the entry point, because all of them, maybe the service provider has just ticked the number of services that the client came in. And from a programmatic point of view, we need to know the entry points so that we make decisions on how do we need to empower the staff from the different service delivery points. So when we realized that we could not track the index service, and also much as we could tell the number of services a client accessed, you had to go to each data capture tool manually and identify and come up with all the services that the client accessed. So we decided to work with a local company to develop a clinic management information system. This is a software that is going to help us to track our clients. And this system, we've already developed it, and we piloted it in 3 sites out of the 9 sites that we have. So we piloted it in 3 facilities, and this is a web-based system that is able to, once the data is uploaded, we have a backup system at the head office level. So every 24 hours, you have all the data backed up in a central place at the head office. We installed the necessary infrastructure. We trained the staff. It was a very participatory process because we wanted the staff to own it, and we also wanted, because they are the ones who are going to be using the system. Then for the 6 months when we were piloting this, we used both an electronic system as well as the manual data collection system, so that in case we face any challenges, we are able to ensure that we don't lose data. So what have we achieved? What did we achieve within the 6 months? We served over 18,000 clients within those facilities, and we realized that these clients accessed over 90,000 services. Now, the current clinic management information system that we are implementing is able to capture the index service, that's the entry point for the client using a color code. We are able to tell the total number of services accessed per client. And also, something about this system, an advantage is that it has the service statistic component as well as the financial component. So we'll get both integrated service statistics as well as associated financial reports for the services that we charge service fee. We exported the data from this system into Excel, and on analysis, 34% of our clients had family planning as the entry point. 30% had VCC as the entry point. The other entry points were antenatal clinic and also the child welfare clinic. Now, our cost of client records reduced by over 400%. That's the operational cost. So we do not have to keep printing all these records. We realize that this system is able to give us all the reports that we need. And so the operational costs have gone down. The installation cost could have been high, but then after the capital expenditure, which is a one-off expense, then you get the cost of operating being reduced. So this is a sample of how the system looks. So if you look at my left, you're able to see that the system can give you quite a number of information, not only on the services, but also different reports. And this is a sample of one of the forms that a service provider has hidden online. So they will just tick the appropriate service based on the number of services that have been that they have provided to a client. And what happens when the service provider ticks this, the system generates a report. And this report is scheduled, is programmed in such a way that we have the different reporting requirements. So if we need our own reports, the system is able to generate our monthly reports. It's able to generate the Ministry of Health reports in their own format, and we just because we customize the templates based on what is required for each stakeholder. Now, this is the color code that I talked about. When you have a client coming into the facility, at the entry point, the service provider will key in which service the client has come for. And this automatically is picked when we are generating the next report, which is showing the range of services that a client accessed. So these two are interlinked. And at the end of the day, you are able to say that this client accessed this number of services, and this was the entry point for this service. So what were our challenges? When we started implementing this project, of course, initially we had issues of data capture. It was not complete because the staff had not been trained. And sometimes when we also use some sessional staff, the data was not complete. But then we capitalized on training our staff to ensure that our data is complete. Then we also had the cost implications in terms of software development, purchase of the hardware, and training of staff. And then the other challenge was balance between service delivery and on-job training, because we prefer doing an on-job training as opposed to centralized training, because the service provider is in their room, which is their comfort zone, and they are able to key in the statistics from their consultation rooms. So what is our recommendation? We need to scale up the clinic management information system, because it's a cost-effective system. It enhances accuracy and completeness of data, and also it gives a lot of information when it comes to decision making. You know which steps or which interventions you need to make because it's evidence-based. So, thank you. That's
Thank you very much, Esther. Thank you very much for keeping time as well. As I said earlier on, we now move on to another presenter, Jasmine Shonami, who is from the John Snow, and is a project director for the Bill and Melinda Gates funded project called the Supply Chain. She's going to talk about supply chain integration in HIV and SRH. Thank you and welcome, Esther.